one way to think about prototyping is it's a method for answering questions about a concept, almost exactly what you said. I like this, but I'm going to put a little twist on it. This is a picture, by the way, of some prototyping that we did actually over in the Clark Center. This is a project. There's actually this company just got bought, which is kind of cool. It just got acquired, around 1,000 babies.
They know Eric too.
Oh yeah, you know Eric. This is Eric's company. Yeah, so these are the prototypes for Eric's company all along the way till the one that finally made it onto a baby. Okay, cool. So why are we talking about this? Well, how many of you brainstormed? You all brainstormed last week, is that right? We have some concepts. Okay. Inside every concepts sort of have hypotheses built into them, right? There are all sorts of hypotheses about these concepts. And some of them are more specific than others. Like there's sort of like the question, does it work? There's a question, how well does it work? Maybe we could get a little deeper. How much force does it take to do a thing, right? So there are lots of questions baked into every single concept. And I like to think about projects as a series of knowledge gaps. You know, I'll introduce this term, a knowledge gap. This is something from my background at Boston Scientific. We talk about knowledge gaps and I have sort of this definition for a knowledge gap. So let's just use this one for today. You might have different ones in different contexts. Any information, knowledge, or capability that's standing between your team and the product being delivered to patients. That's a knowledge gap. Okay. And we think about the project as just a series of knowledge gaps. And some of them are very specific. Some of them might be about safety. Some of them might be about, you know, how does it work? Others might even be about like higher level knowledge gaps, like what skills do we need to make a prototype, right? Like that's, if you don't know that, that's like, probably we should start there and then we should get those skills. And then, okay. So a lot of different sizes and shapes of knowledge gaps. And I like to think about a project in this way. So like, maybe this is where your team is today, right? There's some things that you know about your project, and then there's a bunch of questions that you have. And then there's this whole universe of things you don't even know that you don't know yet. And over time, of course, we're going to try to answer these questions. But maybe even more importantly, and this was kind of brought up by the gentleman back there, more importantly, a function of prototyping isn't just to answer questions, but to figure out these other questions that we didn't know that we don't know, and now turn those into questions, right? So the role of prototyping in discovering new questions, I think, is maybe even more important than the role of answering questions. Answering questions is good too, but I like to think about prototyping a little bit this way, as a method for generating better questions and evolving a concept. And I want to highlight this for a couple of reasons, especially for novice prototypers or folks who are sort of thinking about prototyping and haven't been doing this for decades. The generating better questions part, I think we maybe covered a little bit, but there's another reason, because oftentimes when I set out to answer a question, I don't even get to the question. How many of you have been in that situation where you set out to answer a question about a prototype and then realized that that wasn't even the question that you wanted to ask? You sort of found yourself asking different questions in a different way. Well, maybe just, a couple of people nodding. Okay, we don't have too many hands there. However, you can always generate better questions. The other thing is that it can get discouraging if you're not answering questions, but you're never going to really be answering the questions in the way that you would like to. Oftentimes, it's a process of discovery. So I like to think about generating better questions to keep that momentum. Why do I suggest that it's about evolving a concept rather than answering questions about a concept? What does that bring into this? How's that helpful? Yeah.
It helps you kind of get to the next iteration of your concept.
Right. And that's really important. How many of you have fallen in love with an idea before? You you pursued it maybe longer than you ought to have because it was like, you know, your baby, right? Okay. A lot of us have been there. If we set out to prototype, to answer questions about a concept, sometimes we get stuck, right? We get stuck in that original concept, as opposed to starting from the beginning saying, okay, I love this concept, and also almost certainly the one that's going to work is different from that. So how do we use prototyping to get from what I think it is today to what it might be tomorrow, right? And so this is a slight shift, but hopefully a useful mindset shift related to prototyping. There are a couple other reasons to prototype. One of them is necessity. Let me know the story of the birth of Athena. Greek mythology, any Greek mythology buffs? This is a picture of it happening. This is Zeus. This is Athena, the goddess of wisdom, sprouting forth fully formed from Zeus's forehead, right? Ideas do not come out like that from my forehead. Ideas come out pretty bad usually, and it takes some work to get them to be really nice, right? So we are not Zeus. Learning, people brought this up before. There's sort of the hands-on part that was discussed, both the visualization part and then the creativity part. And then thinking about like, what it's really worth to have something to hand it to somebody. It's fun and it works. So we're going to be practicing iterative prototyping, which is the word that you just used, iterative prototyping in order to advance our process forward. Like you're going to make a lot of prototypes because the first one's not going to work. The first one never works, right? The question is, how do you get to the next one that will work? How do you find your way along this path? And in your projects, there's going to be a path, right? How do we find our way? How do we navigate that path? So prototyping begins with a question. There's some people, and like over at the D School, for example, a common phrase is build to learn. And I agree with that. I like to say, though, you should have a question first. Like, I wouldn't just start building a thing. I would have a specific question about the thing that you're about to build, because I think it helps to direct the building a little bit more. And so once you have one of those questions, though, then you can move on. How can I improve peripheral blood flow? Okay, that's an interesting question. How can this catheter design safely cross a chronic total occlusion? That's a question. How can I simulate the mechanical properties of the amniotic sac? It's an interesting question. This one I like to bring up for a specific reason, which is that, and actually there was a team in this room, a team of undergrads who were focusing on this. And we'll talk about this a little bit later. We'll talk about prototyping the problem. Oftentimes, the most important prototype is not the prototype of the thing that you're trying to make to solve a problem. Oftentimes, the most important part is how you simulate the problem so that you can test your solution. In this case, this team came up with a solution very quickly. They prototyped it within a week or two. And then they spent the next 15 weeks trying to figure out how to simulate an amniotic sac to see if their prototype would work on an amniotic sac. So also want you to think broadly about prototyping, not just about your solution itself, but how do I understand the whole picture? You prototype by making a plan, and then building it, and then testing it, and then assessing it. And then when you figure out that it doesn't work, because the first one never works, then you get to iterate and improve, and you start again. And you're all very good at this already. And the question is, how do we be deliberate about applying this process that we're all familiar with in a prototyping context, particularly if we feel a little bit unsure about the area? How do we sort of keep to this process? How many of you, there are a couple of people who worked in medical device companies, is that true? Yeah, okay. I contend that this is the basic summary of every standard operating procedure that's written in every medical device company. Okay, we talked about how to do this: plan, build, test, assess. By the way, I made this up. So other people just have plan, build, test. I kind of like the assess part. There are different versions of this, but they all have kind of the same basic feel. So if you like a different version, we could talk about that. A couple other things about prototyping. There's a progression to prototyping. So prototyping starts with an idea or a sketch, and it kind of works toward more complex layers. It's also iterative. So you're going to be doing a lot of back to the drawing board, 2 steps forward, 1 step back. So we should be prepared for that type of progression. There are progressions in terms of materials. There are progressions in terms of cost, in terms of time to make it, in terms of completeness. In this class, we're going to be sort of on this side, right? The complex, expensive, lengthy, and complete, probably we're not going to be ready for that yet. So some teams might, but most of us are going to be sort of more on this side. Like, what can we do today? How can we get, how can we make quick progress? And then we'll get to the more expensive and more interesting and more lengthy versions as we go. We want to talk about some terms. Looks like, feels like, works like, and is like. How many of you have heard these terms before? A few of you? Okay. they're not super complicated, but they are gonna be super helpful. So let's talk about them. This is a looks like prototype. Anybody know what this is a looks like prototype of? Blood pressure monitor. That's right. This is a sphygmomanometer. It does not work. This is a looks like prototype. Okay. When I first saw this prototype, I thought to myself, that is a terrible prototype. I was like, that is a piece of trash. And in fact, it probably had been a piece of trash, like just before this picture was taken, when they like literally took it out of the garbage and like, okay. However, I then thought to myself, oh, okay, but what could it do for the project? Right? What could it do for the project? What's a question that you could start to address using this prototype? Yeah, go ahead.
The shapes and the size of the device.
Shape and size, right? We could CAD it up. We could do something really fancy. We could like 3D print the thing, or we could get a box out of the trash and just see, like, what does it feel like? What somebody was, what were you gonna say?
I was gonna say.
You were saying the same thing? Anybody have something different? What else could you learn from this? Yeah, go ahead. And then,
You can actually read the numbers.
can you read the numbers? Yeah. In fact, we could, if we had this right here, I could do a study. Like I could just back up and see, and she could tell me when she can't read it, and then we could go to the next person and the next person, and we could have data, right? It would take what, 10 minutes? And then we would have a plot of like how far people could see it for this prototype. And then we could, you know, we could, of course, we could order like we have an Arduino special LCD screen, or we could just get a Sharpie and like draw on the box. And, you know, how long does it take to make this prototype? 5 minutes, 10 minutes, it depends how long it takes you to like find the right size box in the pile of boxes at your house from Amazon. But so this is a looks like prototype, and we want you to think about what could this prototype do for the project. This other thing, like I saw these things, I don't know if you can see these in the back, there are these like these tubes. And I was like, what are those? Like, how can that possibly be useful? And then it occurred to me, huh, that's interesting. I actually don't know how many tubes it takes to make a thing like this. So maybe it is a good idea to like just grab some tubes and then start to like trigger that thought of, oh yeah, okay, how many tubes does it take? I want us to get a little bit further, maybe even to a feels like, don't read this is terrible slide work. This is a feels like prototype. We're gonna use this for this picture. This is a feels like prototype, also a blood pressure monitor. Anybody have any idea what this is a feels like prototype for?
Good, foot pump for.
Yeah, maybe a foot pump, right? Like if you've done this all day, you're like, oh man, this is terrible. Like we should use a foot pump for this, or maybe we should free up a nurse's hand so they can use both hands and then they can use the foot pump for that. Okay, so this is the idea for this team. Okay. And so what do we think we could learn with a prototype like this? Yeah.
The usability, if it's comfortable for the user or not, like the step they have to like to follow to use.
Yeah, like, okay, so here, if I build this one that feels like it, I can ask them to follow some steps and see if they can follow the steps. What else can we learn? Yeah.
Can they actually press it? Like, does it take a lot of force?
Yeah, like how much force does it take? Like we could, and if we did this, we could probably even measure it. Like it might even be a works like a little bit. Like we could use a force gauge or a fish scale of some sort. We've got like this sort of thing hanging around, and we could like figure out some way to like figure out how much force it takes. The other thing though is that we could just try it, right? How many of you have played like Rock Band or Guitar Hero on the drums and discovered pretty quickly how weak this like muscle right here is? I was like, oh yeah, this is no problem. And then after 10 seconds, I'm like, wow, actually, maybe not. You can figure out whether, am I going to do it with my heel? Am I going to do it with my toe, right? So feels like prototype. How long does it take to make this prototype? Great, so it takes 20 minutes, right? Works like prototypes may not look like the thing. They don't have all of the features. They've got some of the features, but they do a thing that's central to your concept that you can try to figure out, does this kind of work? Ideally, they can get data. So this is an example of like a 3D printed version of a something that's supposed to hook onto the epiglottis during a resuscitation, maybe. This one is a snare that would be used to like grab the spinous processes and the back of your spine and maybe relieve anterior pressure by squeezing together in the back. That's what this is for. Yeah, absolutely, right? You can test a range of geometries. We could maybe get one of these and we could start to look at the different geometries that are on here. As I look at this, I immediately am realizing that like the geometries here maybe wouldn't be great for that, depending on the situation. Okay, what else can we test with this? get more quantitative. How much force, right? How much force can it deliver? What other thing, what else can we measure? Yeah.
You can measure like how much force is needed for the user.
Yeah, right. So we could measure force over here. We could measure force over here. We could measure that relationship. We could relate it to the type of material that we use. We could figure out how much force causes it to break. We could figure, right? We could do all sorts of stuff like that. We could go to 99 Ranch and we could get a pig or like a part of a pig or a big enough part that we could like start to cut down and we could use this. So this is what I want you to keep in mind for your projects. Like, what's the version of this that we could make? How long does it take to make this? Few hours, few days. This isn't like a 6-month adventure, right? This is like, we can put this together. It'd probably take multiple trips to Home Depot because it always takes multiple trips to Home Depot. But you know, we also don't have to reinvent the wheel on this. We can use this mechanism, right? That's another common misconception, is that you have to like do your whole prototype yourself. I like to say that the best prototype is a prototype somebody else has already made for me. So I can just pick it up and use it or adapt it just a little bit. So don't be afraid to borrow, beg, steal, get whatever it takes to make progress on your project. All right. This is the is-like prototype. And this one is, I sort of like to say it's the villain in our story, right? Don't be thinking about your prototype as this. It's like painted, all the wires are like inside, routed very nicely. This took forever to make. Right? This is not your first prototype. This is like prototype number 20, right? So don't like, this is like far in the future. Don't be intimidated by this, right? Think instead about this, think about this, think about this, right? When you're thinking about prototyping, how quickly can we make progress and get to that next question? Okay. These are some other examples that I won't bore you with, except for maybe this one. This is another example of a blood pressure cuff. There's some good things and some bad things about this prototype. Magnets, very popular and exciting. Duct tape, I love the duct tape on this prototype. Doesn't take a long time to make this prototype, right? Grab some magnets, grab some duct tape, put it on. The other thing is that this was very effective in learning something important about magnets, which is that they never work. So all of your brainstorm should involve magnets, and you should also know right now they will never work because magnets are either too strong or they're too weak, and they are never in between. So, and I encourage you to prove me wrong. Every once in a while, there's a device that actually uses magnets in a way that that uses its force. So prove me wrong with that, but also use magnets and have fun with it. There's a rich history in med tech and health technology of kitchen table prototyping, literally making prototypes on your kitchen table. And so that is a good model for this course. Something you could put together at home that you could maybe try in an animal, right? Something you could maybe hand to somebody that kind of works. That's what we want to think about. These are some questions that you can start to address with kitchen table prototyping. There are also risks that are not technical risks. It's also okay to use your prototyping to retire non-technical risks. So we can think about that as well. Usability, market fit, those sorts of things can be part of our prototyping efforts. These are some examples just to inspire you as we transition into our prototyping activity for the afternoon. This is a question. Oh yeah, this team was working on xerostomia. Let me know what xerostomia is. I didn't know what it was. Dry mouth. That's right. It turns out that dry mouth is a problem. Some people, their mouth is like gets so dry at night that it's like a clinical problem. So the question was, can they wear like a mouth guard at night that zaps them in their mouth and causes salivation that would address dry mouth? Interesting idea. So this team in this class created a couple models that might go in the mouth. This is a 3D printed thing. Somebody wore that overnight, and I think it was tethered, although I can't be sure. Don't tell me if you're going to wear stuff in your mouth overnight. That was a little bit dangerous, maybe, but also they learned a ton from that. And then they also did stimulation with a 9-volt battery. Yes, this is a popsicle stick, right? Now, this is the kind of prototyping that we love in this class, right? Like, what can we try? What can we get going just to see? And it turns out that what they discovered was that nobody actually does a great job measuring saliva. It turns out it's hard to know how much saliva is being generated in your mouth because almost anything you put in your mouth generates saliva. And so that's what the team ended up focusing on, is sort of like, how could we do that in a way that's convincing? And so they spend most of their time then sort of like focusing on like, okay, let's say it were to work, how would we know? How would we prove that? And so this is what the team demonstrated, and they were able to demonstrate some pretty significant increases in salivation compared to a baseline. Here's another example of kitchen table prototyping. This is actually a different kind of dryness, is vaginal dryness. And this is a team that was working on like a TENS unit. They were going to apply a TENS unit in particular spots to figure out, okay, could this address vaginal dryness using a TENS unit from the outside? Could they have spent the whole quarter making like an Arduino-based neurostimulator? Yes. Or they could go on Amazon and get a TENS unit for like 25 bucks. And then they have pretty much everything they need. And then they could focus on the parts that were specific to working in, in that anatomy, working on that particular part. Okay, so these are examples of prototypes from previous classes that might be inspiring for ways to do things. Sort of the, like, just bootstrap it with a 9-volt battery, or go on Amazon and buy a thing that does the thing we want, like, and everywhere in between. Okay, when we say a concept sketch, let's start with this example. So this is a concept. The need area was a eustachian tube dysfunction. These are the tubes that equalize pressure in the ears. And the team, the Biodesign team, a few years ago found out, like many good Biodesign projects, there was some paper from the 1970s where they did something in monkeys and it kind of worked, and then nobody followed up. So they were like, all right, let's do it. It turns out that you can electrically stimulate the mandibular branch of the trigeminal nerve to somehow affect eustachian tube opening and closing. So this is their concept sketch. I want you to look at this for like, I don't know, 30 seconds and raise your hand when you think you have a pretty good idea of what this team was planning to do. I see some hands going out. Pretty good idea what they're going to do, right? Okay, they're going to have some implantable pulse generator. That's maybe a jargony IPG. They're going to have some wires that go to here. Probably could have been improved by having like some little electric bolts, like little lightning bolts there. That would have improved this concept sketch. And then it's not just going to be that, but there's going to be some like other parts that are going to work on this. So a concept sketch gives you an ability to understand the big picture. Notably, it is not just a picture of an IPG, right? If it were just the stimulator, you would not understand what's going on here, right? You need sort of the context as well. It also includes different components of the system. It also does not have to be like artistic. A block diagram is different from a concept sketch. It's an abstracted version, right? What do I mean by abstracted? What I mean is you're taking the functions and you're sort of putting them into different boxes, into different blocks that are not the same view as here's how it's physically arranged in the universe, right? So in this case, and it turns out that electromagnetic and electrical devices block diagram a little more easily than mechanical devices or other things, but we're going to ask you to push yourselves on this. Like, what are the functions that you have to have inside of that IPG? And crucially, how are those connected to other things? So we want you to now take your concept sketch and start to turn it into a block diagram. I want you to take, what did I say? Oh, here, let's do. Oh yeah, here we go. So this is the concept sketch, right? Turning into a block diagram. Okay, we're going to take each of the objects and then we're going to think functionally, what does it do? And then we're going to write that into a box, and then we're going to see how does that interrelate. Importantly, we're going to try to be quantitative about this, right? So, oh, okay, the electrodes have to attach to the programmer. Oh, how many connections are there? What kind of things are being sent over those connections? Is it milliamps or is it amps, right? These kinds of things. Oh, this is doing settings. Oh, is there a range related to this interaction? Oh, I see it's via Wi-Fi. Is Wi-Fi the best way to connect these things? I don't know. The purpose of the block diagram is to find the interfaces between the different functional aspects of your system. Those interfaces are where the rubber meets the road. That's where the real engineering is going to happen. So we want to elucidate those by drawing in this way. You know, there's an opportunity through prototyping to develop an understanding of your need, right? Not necessarily prototyping the concept, but just prototyping the problem. How would you recreate the problem so that when you have a solution, you can see if you're solving it, right? How can you do that? This is a challenge sometimes in med tech, but it's an opportunity to develop empathy, to find undiscovered variables. You can also get a lot of important progress on a project by developing a model, whether it's a physical model, an in silico model, maybe it's a mathematical model of what the problem is that you think that you're trying to solve. Trying to build what you're trying to solve will give you a deeper understanding so that when you're solving it, you can really solve it. So I want to encourage you to think about, when we ask you to prototype, maybe your time is spent prototyping the problem and then considering your solution in the context of the problem. So I want to open up that as a possibility with respect to this.